Hello everyone, welcome to the Social Doctor, and this is Dr. Ayushi. The Social Doctor is a platform for the doctors by the doctors, where we discuss journeys, experiences, and knowledge from successful medical practitioners. And today we have Dr. Santhosh Jacob with us. So he currently is the Director of Orthopedic Surgery and Stem Cell Medicine in Bewell Hospital, Chennai, as well as he's heading the Regenerative Orthopedics Department in Chettinad Hospital. Welcome, Doctor, to the platform. It's so nice to have you here.
Thank you for having me, Ayushi.
Yes. Can you just give a brief about, about you? How did you start and everything as a journey of yours?
Yeah, so basically I joined medicine in 96-97 and I completed medicine in 2002 at Ramachandra Medical College in Chennai. And then I wrote the entrance exams and I got into DNB Orthopedics in Southern Headquarters Railway Hospital, which is a 550-bedded hospital in Chennai, very popular for DNB Orthopedics. I finished my DNB Orthopedics in 2008. And after that, I joined as a junior consultant in a hospital called LifeMed Hospital, which is a 50-bedded private hospital. From there, I joined as a consultant in Kaveri Hospital, which is a big corporate hospital in Chennai. I have been in private practice for the last 13 years. And now I head a group of 10 hospitals called Bewell Hospitals. I head orthopedics there. And I also teach at Chettinad Super Speciality Hospitals, which is a medical college in Chennai with post-graduation and super specialty courses.
Yeah.
So that's what I do. That was my journey.
Yes. It sounds so amazing. I'm sure, experiencing it must be, more fun.
Yeah, but I don't want to do it again for sure.
Obviously.
Done it once, I'm very happy.
I
don't think I can do it again though.
Yes. So now when you are into the orthopedics department, there are lots of, MBBS students who at times are not able to clear their MDMS and are looking, because their passion for the orthopedics department, they want to work in the department. Are there any certification courses or any other way that they can work there? Just understand the department more?
When it comes to any specialization in India, we have to be clear about one thing. Yes. There are a lot of trainings, that is post MBBS, you have a registered number, which means that you're a registered medical practitioner. You're a Bachelor of Medicine and a Bachelor of
Surgery.
Which means, and you can anything you're trained for, but if you're operating or you're doing some specialized, it has to be under the supervision of somebody who is qualified.
Yes.
If you have to practice as a specialist, you need to have an MCI recognized degree. That is the Medical Council of India. There is some confusion right now about who's the authority, but still, you have to be registered. Your postgraduate training and the certification you receive after 3 years of postgraduate training, and it is 5 years in the UK, changes in different countries. You have to be able to register that degree in your state council in order to be considered as a specialist.
Yes.
So even though there are a lot of certification courses which are there, post MBBS, even if you train, you will not be considered as an individual specialist unless you have a degree, that is an MS Orthopedics or a DNB Orthopedics or a DOrtho, which is a diploma in orthopedics, in order to practice as a registered orthopedic surgeon. That is extremely important to have.
Yes. Okay. Thank you so much for the detailed explanation, sir. So now when somebody does MS in orthopedics or DNB in orthopedics diploma in orthopedics, as you mentioned, what are the job opportunities for that person after that?
Oh, job opportunities basically in orthopedics depends upon how much hard work you're willing to do. See, orthopedics is actually a very big field. When I joined orthopedics, I thought it was about fractures or knee replacements or spine surgeries. That's all I thought. Even when I finished my orthopedics, I had just a basic idea. But now I realize that orthopedics is a specialty which has to do everything with movement. Anything which helps a person who has pain, who is unable to move. Yeah. The skills you use is actually orthopedics. It need not just be surgery, putting a plate, putting a screw. It can be anything. It can be any modality of treatment which helps a person move better. That is orthopedics. So if you think of orthopedics like that, then there are so many things you can actually do with orthopedics. So you have to think like, how is movement affected? Movement is affected by the things which help somebody move. So what are they? Bones first, without, if there is any weakness in it, your basic structure is gone. So the basic work in orthopedics is with the bone. But just because your bone is all right, really doesn't mean that you'll be able to move, because you need ligaments, you need nerves, you need your tendons, you need your muscles, you need everything. More importantly, you need oxygen going to those muscles to help it move. So right now, I look at orthopedics as something which I use anything and everything which is possible with my skill set to help people move better. That is the actual core of orthopedics. It's not just fixing bones or ligaments, as it is universally understood.
Yes. No, that's nice. Such an amazing definition that you have added to the subject. So now, what are coming back to the questions? What are the job opportunities with this?
Yeah. So job opportunities, as soon as you finish your master's or your DNB, okay, these two are 3-year courses. So I did in orthopedics. Difference right now between your master's and your DNB. I will talk about diploma next. Both of them are 3-year courses. Yeah, so they are equivalent to a master's course. Beyond that, there is no course right now in orthopedics for a master's. It's just MS or DNB. But the only thing is with MS is always in a medical college. So you have teaching experience. So if you have an MS degree, then you can join immediately as an assistant professor in a medical college. Yeah. If you have a DNB degree, if you do your DNB in a hospital which has more than 500 beds, then you can apply directly for an assistant professor's post. Otherwise, you will have to do 1 year or 2 years of senior registrarship in order to get an assistant professor's post in order to teach. Other than that, in private institutions, an MS or a DNB is the same. If you have good skills, if you have good interpersonal relationships, if you're able to make a patient who comes in pain with unexpected trauma feel safe or comfortable, that is the skill they look for in private practice. Now, if you're somebody who has a diploma in orthopedics, a D-ortho, in private practice, if you have experience and if you have good skills, it really does not make a difference. But if you're in a corporate setup, you need a DNB or an MS in order to rise up the hierarchy. With a diploma in orthopedics, it's quite hard because basically you don't get the first choice of cases in a hospital because there is always somebody who has a master's there above you.
Yes. So you always tend to be the junior doctor in the hospital.
It's not like now patients for somebody who is probably qualified and stuff like that, So in private practice, I think that is a big disadvantage if you just have a diploma.
Okay.
Because patients like somebody who has a proper master's degree. That's what I have felt. But the advantage is with DNB, yeah, you can finish your diploma in orthopedics and then do a DNB also for 2 years. So you have a diploma and a DNB, which is equivalent to any master's degree or any DNB degree.
Okay.
So if you're ready to study, I always say, remember, it's just another exam, because DNB is not an easy exam. Very few people clear the DNB exam in the first attempt, So I always say it is just another exam. Just wake up and study and write another exam. If you do that, I think you should be all right.
Yes. So your video, yeah.
Yeah, somebody's trying to call me, so I just
okay. Yes. So that's good, and what about the corporate hospitals? How is the what will you like to mention in regards to practice in corporate?
Yeah, so from my experience, corporate hospitals generally take two types of doctors. Yeah, they take visiting consultants. That is, they are specialists who have their own clinics, private clinics, and they see outpatients in their private clinics. And if anybody needs surgery, they suggest, okay, go to Apollo or go to Max or go here or go there, and they go and operate. They are called visiting consultants. And then corporates have full-time consultants who work for the hospital. They are not paid fees, but they are paid salaries. Okay. So the difference is, if you join as a consultant in a corporate hospital, you don't have to work really hard to get your cases. The corporate hospital will do your marketing for you. But then again, the patients are not yours. They come for the hospital. So the hospital can market anybody who's as good as you and get the patients for them. If they suddenly decide that, okay, this guy is not up to the mark, or this guy is not doing what we say. So it's a double-edged sword. So you can either join a corporate and take the risk, or do the hard work and build your own patients. The difference is, after 10 years, if you have your own patients, most of the corporates respect you much more, because patients are now coming for you to their hospital, and they don't have to invest anything in getting the patients, as they are coming for you. You understand the difference?
Yes.
So I think it is just your mindset. You have to identify what makes you happy. Would you like to be an orthopedic surgeon who wants to do what is right according to your head, or would you like to be somebody who would be okay to work in a corporate? I'm not saying that working in a corporate is not ethical. Many corporates have brilliant orthopedic surgeons, but still, when you start off, working in a corporate might seem easier because you will get some patients every day. But if you're starting your own practice, I have taken my Apple's Orthopedics for the first year of my private practice, and I have sat for 6 hours and I've read 2 chapters or 3 chapters and seen only one patient. That also can happen. You just have to be ready, and if you believe that you want to be in private practice, do it for 5 years at least and see
difference. Yes.
What you're capable of, do easily, because orthopedics is not an easy field to succeed in, because there are giants in orthopedics. Orthopedics is primarily, apart from training, you need a lot of skill, because in orthopedics, to know when you shouldn't operate is very important.
Yes.
Yeah.
That's true. This is the difference between orthopedics and different branches.
Yeah.
That's the big difference. True. So now, after your MS and DNB, if somebody wants to go for fellowships and super specializations, what are the branches in going to that, and what are the good places as well as in India and abroad?
Yeah, see, this is extremely important. Once you have your master's or your DNB and you're registered with your council, you are qualified, or legally you can do any orthopedic surgery. So basically, it has 6 bodies arthroscopy, which is keyhole surgery, spine surgeries, sports medicine, trauma surgeries, and interventional orthopedics. So interventional orthopedics is one of the latest branches of orthopedics. So I do a lot of interventional procedures for the spine. I used to operate a lot on the spine, but then over years, I realized that I prefer to not operate on the spine. So I do something called transforaminal discectomies. That is, without opening the patient, I enter the disc and I repair it. It's quite common now in minimal access. So in orthopedics, if you get good at one procedure, sometimes that one procedure is more than enough to sustain you, especially if it is a high volume field like low backache.
Okay.
Stuff like that. So basically, joints, arthroscopy, spine, sports medicine, trauma, and interventional orthopedics. These are the 6 broad fields you can specialize in orthopedics. Now, they have registered super specializations now in India by the national board called the Fellowship of the National Board. Like DNB is equivalent, FNB is equivalent to an MCH. But for that, you will have to write an entrance exam and then you will have to train for 3 years. But I think in the future, not my generation, but the generation who is doing MBBS now, they will definitely be in a world where they will have to do a super specialization in orthopedics. The reason is that when you train in something, again, a little more than the other subspecialization, you tend to get better results in that. So you tend to do that more. If somebody is a really good general orthopedic surgeon, and they do trauma, they do joints, they do spine, they do everything really, really well. And then suddenly, for 2 years, they're inspired seeing another orthopedic surgeon who's brilliant in spine, and they go and train with him. Automatically when they come back, their results in spine will be better than trauma.
Definitely.
So they automatically tend to do more spine, and as their results are better, more patients are referred for spine. Right now, this is how orthopedic surgeons become specialists in something. That's how it happens. Trainings. Now you have India, where post MS you can apply to a doctor who is very good in arthroscopy or in regenerative orthopedics, and you can ask the chief if you can train with him for a year or so. In foreign countries, the value of a consultant's reference letter is very good, especially if the candidates have trained with the consultants. See, end of the day, it's not about your qualifications. You can have your MCH, you can have 3 MCHs, 4 FRCSs. It is about how safe your patients feel with you when they are sick or when they are traumatized. Yeah. And no qualification is going to give you that. In orthopedics especially, you need to be extremely empathetic, because it is a specialization where trauma or pain is what brings somebody to you, So unless you're able to absorb that stress, I don't think you're cut out to be an orthopedic surgeon. You should revel in sorting out chaos. That's orthopedics for you. If you're uncomfortable in chaos, or if you're unable to see from a distance what is happening and how to sort it out, orthopedics is not the field for you, because you have to remember that in orthopedics you see polytrauma. Polytrauma is, say, a car accident or a train accident. It's not easy. It's not for the weak-hearted at all. It's for people who can move away, who can stop emoting when they want and execute whatever they have trained for. It's a very hardcore specialty.
Yes, that's true. Yes. So nice to know. So for going international as well, you have already mentioned that, what are the good places also, if you can mention what are the
internationally, in I trained in Germany in a place
Okay.
called Celle,
Hmm.
Celle, which is north of Hanover.
Hmm.
It's a village university town. The only thing there is the hospital. It's a 1,600 bedded hospital. They used to do like 15 joints every day, and they used to do like 25 traumas. And I trained there for a few months.
Hmm.
The thing is, you are just exposed. You can see how people handle stress more than anything. In orthopedics, you can learn stuff every day. You can learn stuff from YouTube. You can go and assist your chiefs anytime, and you can learn things anywhere. Like the hand skills you can learn, but how to compose yourself in a stressful situation can only be observed and learned. And
Okay.
for that, I think, especially if you're somebody who's interested in trauma, you will have to go and work in a trauma care center where they have polytraumas.
Yes.
Because if you're exposed to that level of stress, it is a lot easier for you to be confident about small injuries like a fracture of the tibia, or a fracture of the femur, because the patient, when they have a fracture, they really don't know what's going to happen.
Yes.
So training, I would suggest that if you want to train internationally, you're not going to get an MCI recognition for that, but you're going to get exposure, which is extremely important.
Hmm.
Many orthopedic surgeons from India go to Germany and train, because they have very good teachers there. The work they do is very, very similar to India. They just have really good equipment. Yeah, but there are a lot of teaching institutions there where their training system is very, very good. So a lot of Indian surgeons go there to just get exposed about the work culture. And I think it's a very good idea. Generally, when you go abroad, unless you're good and unless you're not going to get to operate too much. That is, individually, you won't be allowed to operate abroad. But you can observe and learn. See, post your masters, you should already have the surgical skills in order to observe, take it in your mind, and come and replicate it. If you're in that stage of orthopedics, going outside for a fellowship is brilliant. But if you're in a stage of orthopedics where you're not even sure about the basic stuff, I would suggest that you go to somebody and learn basic orthopedics first. You should be able to do trauma. You should be good in general orthopedics in order to go and upgrade yourself first. There is no point in going and upgrading yourself when your basic orthopedic surgical skills are not yet up to the mark.
Okay. Okay. That's really insightful, sir. That the problem is that students are not able to understand when to opt what, and your experience of this is definitely very helpful. So we have one to two, all. Yes, please, sir. So we have 2-3 questions that.
No. I'm good.
Yeah. We have
Yes.
2-3 questions.
Yes, I'm waiting.
Maximum we have answered. One is, there is one person, Narul Hassan. He's asking that I have a background in engineering mechanics, and I want to work in the domain of orthopedics biomechanics. What are the major problems patients are having and need to address by medicine and engineering knowledge? Is there something?
Yeah, that's, actually biomedical engineering or engineering in orthopedics is extremely important. Most of our new implants, the new instrumentation which comes, because orthopedics, many people think orthopedics is about fixing bones. Orthopedics is about restoring alignment. Restore alignment of your skeletal structure in order for you to be able to have your center of access. If you don't have a center of access, your walking will be wrong, your sitting will be wrong, your running will be wrong, everything will be wrong. So orthopedics is about restoring alignment primarily, So biomechanics, somebody who's an engineer, I think the ideal thing to do is to approach a college which is doing integrated orthopedic design.
Okay.
So who are designing implants, who are designing instrumentations, who are having tie-ups with colleges for research, and also to approach implant companies like Johnson and Johnson, anybody who is designing orthopedic implants. Or another option is if they're interested in helping people to rehabilitate, designing of like support systems for walkers, anything to help people move, because engineering can help align the body when the body's alignment is wrong.
Yes.
Or it is not corrected. Those are the options they have.
Yes.
But you need to first know the engineering of the body in order to be able to integrate like basic engineering into human engineering, which is orthopedics. But I think good potential is there, definitely.
Okay, that's a really nice answer. I'm sure it will be very helpful for him. So that's it. I believe we have answered most of the questions, sir. Let's end this thing with a high note. Something that you want to tell the students and the viewers who are listening. Something motivational from your end.
Okay. See, I'm going to be really honest. Most of the learning which I did was after my MBBS. So if you're a doctor who is in MBBS and you feel that, oh my God, I don't know anything, I'm not learning anything, please, none of us knew anything after MBBS. Yeah. Please don't think that it is the end all. You start learning something in your post-graduation, okay, because then you're a little bit older and you know that you have to know this in order to earn your keep. But the real learning occurs when you take what your patients say seriously, listen to them and give them what they want first. Try your level best. Use all your skills and education and knowledge to give the patient what they ask. Always, even if the patient needs a spine surgery, if it's obvious, even if they will get paralysis if they don't do, remember, the body and the disease is the patient's. So if they say, I don't want to do a surgery, use your skills to respect what the patient wants. Explain the risks, of course, do everything legal, but try to give what the patient wants. Trust. If you start that at a young age, the way you respond to patients' requests itself changes. Don't think that I know everything. We don't know anything. Trust me. If 15 years of orthopedics has taught me any damn thing, it's that we do not know anything. A patient who lives with a disease for 15 years knows much more about it than you who have studied about it for 1 month in 3 years in your post-graduation. Respect that. And there will come a time when you will know more about the disease than a patient who has had it for 15 years, because you would have been taught by patients throughout your life, and you will know more and you will be able to help a patient. So what I'm saying is, you might be qualified, but be humble. It's extremely important. Remember that what the patient asks you might be the right thing to do for the patient. So try that first, because it's the patient's disease. The patient knows what he has to achieve. You only know what is the best option, and that is not always what the patient wants. Young doctors who are watching this, remember that there is nothing right, or there is no one solution in medicine. The solution is listen to your patients and try to give it. Because in some people it will work. Patients know more about you, about the disease. Just remember that from the beginning. Be humble as hell. Seriously, I think that is it. You learn so much when you're humble.
Yes. Yes. That's so nice. You know, that's something that goes with all specializations and with all kinds of patients. That's so true to learn. Thank you so much, doctor.
You're welcome, Ayushi.
Yes. In fact, I've got one more question by Dr. Vadlamudi Chaudhary. She says that after my MS in orthopedics, if I go for fellowship abroad, can I practice there for my rest of life?
She will have to get registered there. So basically the MBBS, which we do here, you can write a qualifying exam in Europe and you can write a qualifying exam in the US and in the UK. But after your MS, you will still have to write the basic MBBS qualification exam first, and you will have to complete training. Just a fellowship, they will give you a limited registration for a year so that you can practice there. But after that, unless you have their basic medical registration, you cannot practice there. Just doing a fellowship is not enough.
Okay. Thank you so much, doctor. It was so nice hearing about all of the things from you. It was so insightful, and I'm sure it would have added to so much to the knowledge of so many viewers. And I'm sure it will be, they will gain a lot of knowledge from that. Thank you so much, doctor.
You're welcome.
So much, everyone.
Thank you for having me.
Yes. No, it was our pleasure. Thank you so much, everyone, for listening to us, for gaining, for gaining so much of knowledge and to understand the depth in the subject. I'm sure it must be helpful for you. Please share with your friends and colleagues. It might be helpful for them as well. There's an amazing session coming this Sunday. Do join us live at 11 a.m. on Sunday as well. I'm sure that would also be helpful to many of you as well as your friends. Do share this and let other people also know about this. Thank you so much, doctor. Thank you, everyone.
Thank you.
Yep. Thank you.